So all of the work that we do within the HSE, and also when we try to inform campaigns within the HSE, they're all based on research. So that's why I would like to present some of the research findings that we did on the topic of brain health amongst the general public. But before I go into the findings, I just wanted to put up the definition of brain health here, because it is the definition of the World Health Organization. And I think you might appreciate that it's not an easy definition to actually read or understand. It's a three-part definition. So basically, brain health is the state of brain functioning across cognitive, sensory, social, emotional, behavior, and motor domains. So there's a lot there. The other aspect is it allows a person to realize their full potential over the life course. And then the third aspect is irrespective of presence or absence of disorder. So it's very complex. So I try to make it a little bit more accessible by saying, well, brain health is really about making the most of our brain and helping us to reduce some of the risk to the brain as we age. And the brain is really responsible for everything, isn't it? A lot of things, for our memory, for our learning, for our interactions and play, and for our concentration. So it is important to look after our brain health. And I'd like to say that while we within the National Dementia Services now on the topic of brain health look at the dementia risk factors and the risk reduction of brain health. Brain health is really important also if you have a diagnosis of dementia, and that we continue to look after our brain health. We heard a lot about cognitive stimulation therapies, about post-diagnostic supports, about community engagement. All of these things are just as important whether we have dementia or not. So I'd just like to say that. A lot of research has gone into the topic of brain health, and there is more and more evidence now that there are potentially 14 modifiable risk factors for dementia. So some risk factors we cannot change. So our genes, for example, is our risk factor we can't change. Aging is a risk factor we can't change. But there are 14 risk factors that are modifiable. And if we address all of these 14 risk factors, we can potentially reduce dementia by about 45%. So if you think of that, that means we could also potentially delay the onset of dementia by 5 years. And that means we could halve its prevalence. So it would have a massive impact on people's health and well-being if we become more and more aware of these modifiable risk factors. So the Lancet report from 2024 actually has this nice curve of the different risk factors. I don't expect you to read them all because it's difficult to read, they're so small. But what they try to do is they try to separate them into early life, midlife, and late life risk factors. And they start off with education. So education is a risk factor for dementia, but also things that we might not be aware of. A topic of hearing loss is a risk factor for dementia. High cholesterol, depression, trauma to our brain, if we're physically inactive, smoking, diabetes, all of these things are risk factors that we can address. And then in older age, there are also risk factors such as social isolation. We often speak about people, we heard it today again, about people in rural Ireland. So the aspect of social isolation as well is a risk factor for dementia, in addition to visual loss as well. So these are all things that we can address and then hopefully reduce our risk of dementia. So as I said, all of our work in the HSE is always based on research. So we commissioned this research into brain health. And what we basically wanted to understand is we wanted to really get a better sense of what is the public's awareness and knowledge of the dementia risk factors. We also wanted to look at, well, what are some of the health behaviors that people do in order to look after their brain health? And then we wanted to gather these insights to really inform, well, how are we going to communicate to people? How are we going to reach people in their communities to really make them more aware of the topic of brain health and the things that they can do, the practical things? So the research was divided into 3 aspects. One was knowledge gathering. So basically, we did a lot of literature review. We did an exercise called social listening. So it was really interesting. So what are the conversations on social media when it comes to the topic of brain health? And there wasn't really a lot on the topic of brain health. Then we also did, interviews with experts on brain health just to get their insights as well. We had an online survey, and I'll show how many people participated in that. And we also had focus groups as well to really just go into deeper conversations on the topic. So as I mentioned at the start, there have been different research papers written on the topic of brain health and awareness, but there's very little really focused on women. So we wanted to understand, is there actually a difference between men and women and their understanding and the things that they do to look after their brain health? So we had a total sample size of 1,500, out of which 1,000 were women and 500 were men, just as a comparison. And then we also conducted 4 focus groups, and those focus groups were small little groups. There were 5+, so between 5 and 8 participants, so we could really have meaningful conversations on the topic of brain health. So I've divided the slides now into 4 sections, and I know the slides will be available, so I really do not expect you to read all of the graphs and so on, but I'll talk you through it as well. So the first thing was really for us to understand, well, what are some of the key behaviors? What are some of the lifestyle things and diets that people do? So we asked them, how often, if at all, do you currently do the following of the week? And we asked them about physical activities. We asked them about healthy eating. We asked them about, reading, meeting friends, and so on. And what you can see there is that the majority of people do something like, they go out and they meet friends and family and so on. And they also would exercise or read. But just over half of them say they do something specifically designed for brain health. So that they would do specifically quizzes and exercises to look after their brain health. So there was a bit of a mix of activities that people were participating in. We also, asked, whether they would agree with some of the statements that we have here. And, that there were really high levels of agreement that exercise is important, for our mental health. And I think we know that people have a better understanding of the topic of mental health and depression now. So they really associated, brain health also with mental health. And so people felt that exercise is really important, healthy eating is important, but also 7 in 10 agreed that it's really important to stay socially active as well. So that was actually quite positive, that people felt those things are important to, for staying well as well. When we looked at what are the main exercises that people do, I think it's no surprise that walking was the main exercise. But also then you could look at gentle walking. So again, especially people who were 50, females who were 50 plus, were more inclined to do gentle walking. There was brisk walking. There was gym workout as well then with women who are younger, as well as yoga. But what struck me with all of these things was that they're all exercises that people can do on their own. But where are all the group exercises or the team exercises? So those sports actually were quite low. So when you talk about, football or golf or tennis, or where you're actually meeting up with people, they were quite low. So that was just something for us to take away and see what are the exercises that people do. We also asked about smoking, because again, smoking, of course, is a risk factor for dementia. And we felt that these figures are actually quite high if you look at them, that, with almost 1 in 5 females aged 30 plus claim to be smoking daily. So that's quite a big number there. And we're looking at the left-hand side there at figures of, 18, 17% and so on of people smoking on a regular basis or smoking daily. So those are quite high figures of smokers amongst the female population. We also asked about alcohol, again, another risk factor for dementia. And again, you can see that, quite high levels of alcohol intake, and the intake increases with the age as well. So especially females over 50 had a higher intake of alcohol units per week, but 7.3 units would have been the standard across the board. So again, quite high. But in saying all of these things, we also wanted to get a sense of, well, how do people deem actually their general health? And the most part, people felt that their general health was actually quite good or very good. So they had this perception that they were doing quite well. So that's a very positive outlook already. And then we also asked them whether they're health conscious. And again, the majority would have said, that they are health conscious. And then some of them have also said that they're very health conscious. So again, it is something that is in their mind. It doesn't necessarily translate into them taking actions. We'll go into that. But I think it is a good base already to get a good understanding. So then we wanted to know a little bit more about, well, what is their knowledge and experience of diseases and also of dementia, of course. So we asked them a bit about, like, how much do you feel you know about each of the following conditions? And I know, again, the figures are very small, it's hard to read. But what struck us, first of all, is that dementia is the third lowest. So you're looking at other conditions such as depression, obesity, cancer. Those are conditions that people would be much more familiar with, and dementia is lower down. But in general, those figures are quite high. So people are much more educated about different types of conditions, and they're getting their information through healthcare, through online searches, and so on. So even when we did the research in 2021 on how familiar people would be about dementia, we had 32% of the population saying they would be very knowledgeable. That has gone up to 45, but still it's not as high as other conditions. So there's work for us still to do. Then I think this, again, doesn't come as a surprise. We've asked these questions before in other studies. And when it comes to asking, which of the conditions would you be most concerned of developing in the future, dementia is right there behind cancer. And really with quite a high percentage of 21% of people being concerned about developing the conditions. The next one below that is heart disease with 7%. So you can see, like, there's a big prevalence when it comes to cancer and dementia and the worry about that. We asked them as well what conditions people would have been diagnosed with within the last 12 months. And the majority would have been high blood pressure, depression, high cholesterol. So again, that explains a little bit as well, that increased knowledge of those kind of conditions as well, because people would have had a diagnosis, they would have, read up on those diagnoses as well, so their knowledge would have gone up. Now, we did ask, and we wanted to ask that specifically as well because of women and menopause, and there's a lot of conversations around that and memory concerns. And almost 1 in 4 women said that they have memory concerns, and females generally much more concerned than males in this regard. But despite having these concerns, and again, it's probably not a surprise to people, 7 in 10 claim not to have sought a diagnosis. So even though we might have these concerns, we have these worries, we have these anxieties, all of these things about our memory, we still are a bit fearful of going for a diagnosis and finding out what is actually happening to me. But when people did go to get a diagnosis, the causes given were poor sleep, stress, anxiety, depression. So those were the main causes for memory concerns, but those are all risk factors for dementia. So if we don't address them, if we're not aware of this, they're all risk factors for dementia. So again, something that we really have to put out in our communications. Now, I think this is really the key for all the work that we need to do going forward, because we also asked them, which of these conditions do you think you could reduce the risk of developing by adopting a healthy lifestyle? And dementia was really low down. So people do not connect the topic of lifestyle and modifiable risk factors with dementia. They're not aware that if they reduce or do something for their exercises, their heart health, their diet, hearing loss, vision loss, they're not connecting that with dementia. So we really have to get that message across, that people are aware that it's not just topics such as obesity or heart problems or high cholesterol that we're addressing. It's really lowering the risk of dementia. So we have to get that message out. So then we also wanted to understand how much do people actually know about brain health? Is that a term that people are familiar with? How do they, think about brain health? And 1 in 2 claim to be familiar with the term brain health, but just 1 in 10 are very familiar. So you can see there's a real mix. So maybe 50% say familiar with the term. But when we then in the focus groups asked them more about brain health, what they basically were saying is, yes, I can do Sudokus to keep my brain healthy. I can do quizzes to keep my brain healthy. So it's very limited knowledge, even though they think, that they might be familiar with it. They're not quite sure what it actually means. So again, we have to break it down to people to really make it very accessible of what are we talking about when we're talking about brain health. But which is, again, really, really positive for us is that, a lot of people feel that it is important to actively look after your brain health. So over 50% said it's really important. And then you see there's another 30-something% who say it's somewhat important. So high figures of people say it is important to look after our brain health, even though they don't quite understand why and how it's all interlinked, but it is really important. So again, that's a good base for us to start off our conversations. We did also ask, we wanted to know, how they felt, at what stage in life should we actually start looking after our brain health? And is it at some point too late to look after our brain health? And again, you can see that people have a real mix of answers. So they weren't quite sure whether it's early years, mid-years, late years. But 1 in 4, 42% said it's never too late. The others said other ages maybe where you should start, but 42% said it's never too late. So hopefully we can just build on that and increase that, and that people understand it's never too late to start looking after our brain health, and regardless of whether you have a condition or not. The majority are confident that they can improve their brain health. So again, it's really good for us to know that that confidence level is there. But when we then ask them, what are some of the barriers to brain health? You could see there's a whole list of barriers here. But the main barrier was that people didn't know what to do. So again, we really have to get messages out to people of what are the small things we can all do to look after our brain health. But people said, I'm not sure what to do. And then in addition to that, there were also other barriers. And I think that's very normal and it's very, clear to all of us. One are our mindsets. So sometimes we're not motivated to eat well or to exercise or to engage with people. We also sometimes might, we want to see results immediately. And if they're not coming, we lose motivation again. And also change can be daunting. We're talking about behavior change. That takes time. That's really something that we have to invest in. It can be very daunting for people. And then we have practical things that people feel, living healthy is also a high cost involved with that. People have time constraints. They have very busy lives. So they're very practical things as well. And depending on the age group of the person answering this, they're very different practical things. Some might be looking after children, some might be working, some might be looking after parents or spouses. So there's very competing family care priorities as well. We did ask where would people go for information, because we wanted to see if we are building information and we're bringing it out there, where would we go? Who could we ask for help to actually disseminate information as well? And 60% would go to their GP. So, what we noticed again in the focus group is if they were to seek, very specific advice, they would go to their GP. If they were looking in general about omega-3, let me find out a little bit more about that, or brain health exercises, they would go online. They would either look at apps or the websites, or they would talk to friends about things like that as well. So again, quite a bit of a mix there. So then we looked around talked about communication surrounding brain health. And I don't know whether you have heard anything about brain health recently. I know there's a lot at the conference here, which is great that it's on the agenda. But the majority of people haven't really heard or seen anything recently on brain health. And it doesn't surprise me, because we really haven't been pushing that topic of preventative measures. We really look at implementing care and supports and information and getting that out to people. But where is the prevention, and who is talking about prevention? And we haven't really been doing that messaging out there. When we did ask people where they did see something about brain health, social media was the first thing, but also online searches. And then TV was the third thing. And again, I think with TV, it's things like there might be a cooking show and they talk about foods for our brain to keep our brain well and so on. So it's very isolated information that people are getting. And I think it's really important for us that we make it very clear of what we can do across the different modifiable risk factors. We also asked them what kind of messaging would resonate with them. And I thought what struck me here is that people want to get some very clear messages. So one of the messages at the top 4 that was, came out very high was maintaining a healthy lifestyle can reduce your risk of dementia, including Alzheimer's disease. So that's a very clear message that people want to hear, and that makes people actually do something for their brain health as well. The other thing was your brain is the most important organ in your body. Again, that people just realize, oh yes, it is actually a very important organ in our body. So what can we do to keep it well? We tested a lot of different communications, and I only put this slide here to actually show you. It's quite difficult to look at, well, what communications do you develop to actually reach a broad audience. And some things resonate better with others, but what is very clear is that people want simple communications, they want clear links to the topic of brain health, and they want things that are very relatable to them. And also, in addition to social media messages, what people like are video, they like podcasts, but everybody liked a quiz, brain health quiz, to actually see, well, where am I at? What are some of the practical tips for me? So there's a lot of there for us to take in and to see, well, how are we going to address this going forward? So just to summarize as well, and I put behavior change here before the summary because as part of the Dementia Understand Together campaign, we work a lot on the topic of behavior change. And behavior change is not something that's easy. We always go out to say, what can you actively do to support people with dementia in your community? So that's the behavior change that we want for the Understand Together campaign. But here in brain health, we also then looked at, well, where are things that people say, I actually have an awareness, I have a consciousness on the topic of brain health, but when it then is translated into actions, am I actually taking an action for it? The percentage figures go down. So you can see here, people are making a conscious decision to lead a healthier lifestyle, 70%, but only 64 say, I actively manage my health. Or people believe that regular exercise is good for mental health, so 85%, but only 62% say regular exercise plays an important role in my life. So we can really see that, yes, the intention is there, but we have to translate it into action. And how do we do that? One big thing that came out in the focus groups and also through the research, and I think that is something that we can really hold on to. I showed it earlier in the slides, that believe that, yeah, I can do something for my brain health. And that key emotional trigger to behavior change is that belief in the potential of positive changes. So if we can instill that belief in people, we heard a lot today about confidence, losing confidence when you're diagnosed with a condition, losing confidence, you've changed and people don't really know how to engage with you. But that belief in yourself, that is really vital for you to actually then also take actions and to go back out into the community. And it's the same here, is that belief in change is really key. And people said, if I thought brain health could stave off dementia, I'd be all over it now, and so would everybody. So it's really trying to get that message out is something that we have to do. So just to summarize again, I think the key thing for us here was that dementia is still not fully understood as an umbrella term when explored, but there's passive knowledge and there's still that underlying fear of dementia. There's also a real disconnection between not knowing that the risk of dementia can be reduced through the modifiable lifestyle changes. We understand that people have multifaceted barriers, so there's a huge number of barriers that people have to overcome to change their behaviors. But there is that fundamental trigger in that topic of belief. What we also notice is that life stage resonance is really about really capturing where people are across the life stages, because they have different priorities, and we need to make sure that we can really try and reach them despite all of these different priorities that are pulling at them. Also, we're very good at putting information on the HSE website when it comes to finding out services, supports, and other things, but we really have to focus on preventative guidance as well. And then for us, it's looking at, well, how can we adapt the messages as well to really reach people? So what's the next steps for us now? So this work within the National Dementia Service is governed by a working group. So we have approximately 28 people on this group, including Paul Maloney and Sean O'Dowd, and many different program leads within the HSE, but also external stakeholders from research, from the Global Brain Health Institute, and so on. And it's really for us to look at, first of all, to have the publication of these research findings so that we can disseminate them widely, but also then to engage with these stakeholders to really say, well, what are the key messages? What are the key objectives that we want to put out? And then to develop communications and resources around it. We're currently working on a brain health booklet that we're trying to get the key information in there in one booklet that can be used by everybody and all of the different stakeholders, and that we can disseminate information through our healthcare colleagues and wider networks. And the key, again, to all of this is shared learning and collaboration. We heard the term collaboration all the time today, and it's all about collaboration and being able to work together and share messages as well. So a lot of facts and figures, and thank you very much for your time. And I'll finish on that.